Oncologist Dr. Marisa Weiss is the president and director of breastcancer.org. Dr. Ray Chang is a medical doctor who specializes in alternative cancer care. Good morning to both of you.
Good morning.
Dr. Chang, let's first get to definitions. Alternative versus complementary versus integrative. What's the difference?
Very good question. I think the definition has changed with time. 5, 7, 8 years ago, when this field has not advanced itself to what it's like today, what is alternative is defined as what is not practiced by mainstream, not offered at hospitals, not taught in medical schools, not reimbursed by insurance. Over time, that has changed, as we have all seen. And more people are using alternative therapies. More mainstream doctors are accepting them. So they have come together and become complementary, because alternative implies either or. Complementary goes side by side. And the future, hopefully, is integrative when it's going to be part of somebody's treatment program.
Dr. Weiss, you are among those who are more accepting of this idea of offering a patient alternative therapies. You actually send some of your patients to Dr. Chang. Why? What does he offer that you can't give them?
Well, very early on, I realized that you need to treat the whole person. You really need to take care of the whole person. And there's a lot more than what's in the hospital that we can offer. I've dedicated my work to patient education because education really does complement the surgery, the radiation, the chemo, as well as all these choices from the alternative medicine world through breastcancer.org. But basically, I knew for Antoinette that there was much more for her.
Antoinette being the young woman we just heard from, right?
And what was in the hospital, there was more than I could offer her that was out there. She's an amazing woman, and I knew we could take advantage of the power of her mind, and she expressed to you what she was doing that way. But also, she wanted to pursue sort of nutritional things. What could she do herself to become as healthy as possible over time?
How do you decide, Dr. Chang, what to offer? I mean, we heard some things she was mentioning that I had never even heard of before. Do you also don't move into things like acupuncture and areas that people are still discovering whether or not there is an actual link to health?
Yes, there are many modalities, and the field includes so-called mind-body techniques, meditation and exercise, qigong that she mentioned, which is breathing exercise, dietary change, lifestyle changes, supplements, herbs, you name it, including the use of newer things which are not yet available. But I think we decide based on the patient. At various stages, what are they doing it for? Is it for prevention of recurrence? Do they have disease that is still active, that is not responding to conventional treatments that need additional help? It very much depends on the patient, and it also depends on what the patient can do.
Supplements and herbs, that's a red flag that's going off because, that has to be working in conjunction with the kind of chemotherapy and radiation treatments, right, Dr. Weiss?
Absolutely. Well, 25% of the medications in the hospital pharmacy come from plants. So plants are not necessarily safe. So I need to know what Dr. Chang is doing, and he needs to know what I'm doing. We need to coordinate this so that she gets the best of both worlds.
Isn't that the worst idea, though, for a doctor who's a medical oncologist like yourself, that someone would be doing something without consulting with their medical oncologist? In other words, what do you do, Dr. Chang, if a patient comes in and doesn't really wants your kind of care, but is unwilling to share it with his or her doctor because she's afraid or he's afraid that the doctor will not accept this idea?
That actually happens quite a bit. What we try to do is refer the patient from a conventional doctor. We not only spell out the exact recommendations and provide medical references to that, we try to engage the other doctor. And certainly, if there's disagreement, we won't proceed. And that is a common issue. And as frequently as I suggest or prescribe supplements or herbs, I also frequently tell them to stop things. Many people come with bagfuls and bagfuls of supplements, and they go into the store, and they've been told to get this and get that. Yeah, bagfuls, and we actually edit or annotate a lot of that and try to help them clean out what's unnecessary.
Exactly.
It's not just that we could give them, supplements.
We just have a few minutes left, but Antoinette, the one we heard from, was lucky because you directed her to Dr. Chang, who knows what he's doing. What about women listening right now who are undergoing treatment or about to undergo treatment for breast cancer? how can they find someone who can really help them in this?
One thing I was really concerned about is that Antoinette's cancer was estrogen receptor positive, and I know that there's a lot of herbs in the alternative medicine world that might stimulate those receptors. So I needed to have her go to somebody who would choose the right herbs and avoid the dangerous herbs.
How does a normal person find somebody?
I go to their doctor and make sure that he had the proper training.
All right, Dr. Marisa Weiss, thank you so much.
Thank
I'm so
you.
sorry we're out of time to talk forever. Dr. Ray Chang, thank you as well. If you'd like more information about our special series, visit our website at today.msnbc.com. And tomorrow, insurance coverage. We're back after these messages.